Thank you so much for that warm welcome, and a good morning or afternoon to everyone that's joining us today. Going to be talking a lot about evaluation and management and documentation. That's going to be our main focus today. And I know the webinar is definitely called the new 2022 rules, but they're primarily the new 2021 rules, and then just a lot of things that we've learned since those rules have come out, and definitely a lot that we've learned this year for sure. So let's go ahead and get started. So first and foremost, the big changes that we saw with the new definitions of our E&Ms, there was a lot of changes in the verbiage of our E&M codes. So first off, they did delete the new patient level 1 99201 effective January 1st of last year. So that is no longer a thing. So the reason being is if you're seeing a new patient as a provider, there really is no reason that the provider should not see that patient. If there's got to be some sort of clinical reason why that doctor goes in, even if it's for a very straightforward problem and they decide not to see the patient any further. So that 99201 was pretty much obsolete anyway, and people were misusing it often. So that's why that was deleted. So we're no longer using that code. So if you are using it and you're getting denials, that would be why. So anything that you would have used a 99201 for before would default to 99202. And there are some changes in the definition of that, where it used to say 3 key components. That is now removed, and it is changed to an appropriate history, medically appropriate history, and we'll talk a lot about that. And then medical decision making of straightforward. And then it also includes a time stamp of 15 to 29 minutes spent in the encounter. So again, I'm going to go into these in detail based upon the different levels here in a little bit, but I did want to just bring this up with the deleted code of the 99201, that is no longer, and that would default back to the 99202. The objectives for today, I really want to go into time versus complexity. That's a big one that people are just getting very confused about, and a lot of providers are just defaulting back to time because they don't want to deal with what complexity means and what they have to document and all of that. But it really is a lot better to document for complexity, and it's a lot easier than a lot of providers think it is. So then we'll obviously talk a lot about the changes that did happen, as well as the changes in prolonged services. Then we're going to talk about the table of risk, which is, kind of brings us back to that complexity, but we're going to dive into that really, really deep, and we'll talk about some examples that will help you kind of understand where those things can be used. And then we'll talk about how we can build our templates to help us make these things easier, and then how we're going to effectively educate our providers. I don't know if there's providers on the call or listening to this webinar, but I'm going to speak to both clinical staff and non-clinical staff, because I think it's important for everyone to feel like they understand these things and that they can implement them in their current positions. And then, like they were saying at the beginning of the webinar, if you have questions, I will leave 15 minutes or so at the end for questions. So please make sure and write down your questions so that we can talk about those at the end. Moving on to our other E&M coding. So we're still talking about new patients. Our level 3 was changed from the 3 key components to low medical decision making, and using time, it would be 30 to 44 minutes. For our level 4 new patients, it is a moderate level of medical decision making, and again, we'll talk about that. And time is typically 45 to 59 minutes. And then finally, our level 5 is a high level of medical decision making, and the time is 60 to 74 minutes.